Hey everyone, Dr. Pedram Shojai back at the Health Bridge with Dr. Sarah Gottfried. Hi Sarah.
Hi Pedram, hello everyone.
Hey, so we are going to take a minute to answer a question from a listener. Lisa Parker Danielson has asked us about basically the role of nurses in the new healthcare model. And this is something that I spend a lot of time on because we do a lot of corporate wellness over at well.org. And so here we are. I'm going to answer your question. We're going to start doing more of this, you guys. So basically, you know, the question is, in the functional medicine movement, she's 23 years as a nurse, you know, what's her position? How can she leverage her experience and get involved? And my answer to that, Lisa, is, oh my goodness. Nurses are going to be at the forefront of the healthcare deal. There's not enough doctors. Doctors are going to be relegated more and more to dealing with actual disease processes, and the nurses and the pharmacists, you know, look at what Walmart, Walgreens, CVS, look at what everyone is doing on the front lines of who they're hiring and what they're doing about this. Is the front line of actual healthcare and lifestyle diseases and lifestyle management things are going to be pushed over to nurses, RNs, to be able to quarterback. And as things start escalating up, or they find specific diagnosable diseases that really need to be, you know, kind of up funneled in the algorithm, then the medical doctors are going to jump in on the disease processes. But the model for healthcare in the future is really shifting. So the boots on the ground are going to be nurses and pharmacists at local touch points that are going to be in pharmacies, like these mega pharmacies on your street corners. So the entire medical model and like the family clinic model is dramatically shifting. And so you are incredibly relevant in this new world. And I highly encourage you to not bother going and getting a medical degree, because you're going to be very well sought after in the way healthcare is shifting. That's my opinion. Sarah, what do you got something on that?
Well, I totally agree. I mean, I have to say that I think nurses are the ones that really help with some of the most challenging parts of functional medicine, the implementation, the compliance, as you said, kind of boots on the ground, having those conversations when a patient calls in and says, okay, I know I'm supposed to give up gluten, and guess what? I'm powerless over the sandwich that I have every day at lunch. What do I do? You know, I feel like functional medicine, we talk about it at kind of a high level. I talk about Jeff Bland. We've had Mark Hyman on the show. We talk about the Institute for Functional Medicine. And I think the truth is, when it comes to transformation in health, it takes a village. You know, it's not just that, okay, Mark Hyman happens to be kind of the president of the board and one of the leaders in functional medicine. Just because we don't see an RN, a registered nurse, who's the president of the board, it doesn't mean that, you know, it's an important role in terms of the healthcare team. So I wanted to maybe get a little bit more granular about some of the thoughts I have about nurses getting more involved. One way is through the Institute for Functional Medicine. You know, if you have a degree in nursing, you are most welcome to go through their training. They have a lot of really good training for all different types of people. So not just the physicians and the naturopathic doctors and the osteopathic doctors and the chiropractors, but for the nurses as well. And I just went through their AFMCP, Advanced Functional Medicine and Clinical Practice, applying functional medicine in clinical practice. And I think that is a beautiful way to start. There's also more and more training programs out there for people who want to learn more about functional medicine. And, you know, for some nurses, what they decide to do is they want to become a nurse practitioner. There's certainly a lot of nurse practitioners who are in functional medicine, and they have more of a, maybe a more independent role in some ways. But, you know, ultimately, I think that's a very personal decision. Another kind of granular piece of advice is to really look to the Cleveland Clinic right now as a nurse to see the models that they're growing. You know, Mark Hyman was talking to us on the show about his work at the Cleveland Clinic and bringing functional medicine to this mainstream, prestigious medical campus. And the challenge is they're trying to prove the model of functional medicine. And once again, I think nurses play a really important role. And so as a nurse, I would look at, if I were a nurse, I would look at, okay, what's happening at the Cleveland Clinic? what are the roles for the nurses? Maybe there's a research role as well as a clinical role. Which one appeals the most to you? And, look to those people who are the early adopters, like the Cleveland Clinic, in terms of the ways to get involved in functional medicine and the sort of role that you can have.
Love it. Yeah, there's also the Holistic Nurses Association. There's a lot of directions. If you want to be patient-facing, then you could even interface with patients in multiple different kind of touch points. But then there's nurse case management and how you can help move disease processes along. Because really, where a lot of the issues in the Western medical models are, in America in particular, is that there's just this enormous case volume of people that are sick and have diagnosable illnesses, and really kind of like the big swim lanes of heart disease, diabetes, obesity, and things like that, which are costing the country a fortune and bankrupting corporations and all this. And the intercept points are usually lifestyle, right? So as a nurse case manager, you could come in and just change diet, exercise, stress, and all the things that we talk about till we're blue in the face, but be that connecting point between the lifestyle and the disease, and intercept the disease, hopefully on the front end for certain populations, or manage the disease as it's already happened in other populations. But every single one of these, nurse has plenty of skill, and really probably great people skills and all the other things that come with interfacing with human beings more often than a lot of the doctors who've been trained to read labs, drop diagnoses, and run. It doesn't take away from what the doctors are doing, but it's a really compressed model where there's just a lot of sick people and not enough doctors to help them. And the hospital model is going to be relocated towards, kind of higher up disease processes as the population explodes, and all this lifestyle stuff that's really inefficient and messy, that's going to change. And that's already been kind of mandated in the Affordable Health Care Act. And it's also, the reality is there's lots of money going into app development, technology, and lifestyle programs and wellness programs to change the face of this healthcare crisis and hopefully bail water out of a sinking ship. So I'd say, just be the best nurse you can be. Read, go to the IFM, Holistic Nursing Association, and just step into those shoes and be really kind of like a torchbearer for the next round of what nursing is. Because man, Florence Nightingale, she was awesome, right? And so, you got to step into those shoes. And I think there's going to be a resurgence of nursing in this country.
I agree with that. And I think that I'm really glad you brought up this lifestyle point. I think we are getting more and more in this place of seeing hospitals as kind of catastrophic care. And the real implementation of functional medicine is going to happen kind of one-on-one in a medical practice, or even with health coaches, nutritionists, this collaborative team. And I appreciate this point you just made, Pedram, about collaborative compounding. That it's this old school idea that it's the physician sort of saying, here's your prescription, see you next year. That just doesn't work. Like, we need to help people try to close that gap that leads to the health challenges that they have. And I feel like nurses are such a central part of that conversation and that action that we want to step into. And getting really specific again, I would say for a nurse who's trying to figure out, maybe for a nurse who's worked at the hospital for years and years and is trying to figure out, okay, how can I do more of this functional medicine thing because I'm not seeing how to do it here in the hospital setting. You could take a look at some of the medical practices that are out there that are doing functional medicine or have some sort of hybrid. You could go to functionalmedicine.org and you could look up some of the practitioners that are in your community. And you could find out about, roles for nurses that are in those practices. Another thing that I've seen nurses do, I have one nurse that I'm thinking of in particular here, is that they have considered some other ancillary training. So beyond just IFM, another place you could go is to develop yourself as a health coach. I think it's a very different kind of set of skills than what you learn in nursing school or medical school, and it's a great kind of adjunct in terms of your toolkit that you can bring to helping people implement the functional medicine protocols. The other thing that I see people do is getting more advanced nutrition training. And there's many places to do that besides IFM. You know, I'm thinking, for instance, of Cynthia Pasquella and the Institute of Transformational Nutrition. There's lots of others that are kind of growing up in response to this need and this interest that Lisa is talking about.
Yeah, Lisa, rock on, keep getting better at what you do, and your skill set is going to be one of the most valuable ones on, on the new continent that we're just about to, kind of start colonizing here, right? Like this is the future of where medicine is going. You will have an integral role. The old hierarchies and kind of weirdness of that world have shifted, and lifestyle is really the elephant in the room, and we're here to tackle that. Just as a complete quick disclosure, neither Sarah nor I have anything fiduciary related to the Institute of Functional Medicine. We are just fans of what they're doing. So this isn't us trying to send people to anything that we're involved in. I haven't seen a program that's that clean and good in a while. So just to be clear, we're just fans, right? That's it for me. We are gonna keep doing these. You guys let us know, put your questions up, and we're here to answer. Sarah?
Yeah, so, leave us your questions. I hope Lisa got something from this conversation that Pedram and I had today. We want to hear from you. We want the feedback. This is an ongoing conversation, and we're listener driven. So please leave us your comments and your questions, your suggestions for future topics at facebook.com/thehealthbridge.
Awesome. Good to see you, Sarah. Thank you, everybody. We'll see you next time.
Bye.